I'm the representative from Minnesota's 6th Congressional District. We thank you all for coming today for this press conference. And just on a personal note, as an aside, I just want to say thank you to the Minnesota Vikings for a wonderful season that really gave us a lot of joy and a lot of hope. We're so sad about what happened last night. We wish we could have seen a win, but on a personal level, for my family and I, we want to thank the Vikings for giving us just a great season. So thanks again. The reason why we're here today is to talk about the issue of health care. And it's interesting because a lot of people think that the health care debate is dead. But it's not dead. If you listen to the administration and to Speaker Pelosi and also to Majority Leader Harry Reid, what we are doing today is letting you know, giving you a heads up that we are rejecting politics as usual in Washington, D.C. in dealing with this important health care issue. It's caught the attention of the American people. I think the people of Massachusetts spoke very loudly in a way that is reflective of the broader segment of the United States, but what we want to do is seek a new way forward in talking about the issue of health care, and we want to propose ground rules for going forward in a brand new health care bill. And just to give you a little bit of background, this weekend both Speaker Pelosi and Majority Leader Harry Reid insisted that health care legislation would go forward, but they haven't publicly said how they would do that. As for the president, he said on Friday during his speech in Ohio, he said of health care, quote, "This is our best chance to do it. We can't keep putting this off." Then Majority Leader Harry Reid told Politico that no decisions have been made, but the office is confident they will pass health care reform legislation this year. So we don't want anyone to think that this issue is dead. We don't take it as being dead at all. We think it's going forward. In fact, the president announced over the weekend that he is bringing in his former presidential campaign manager on board, and that is Mr. David Plouffe. And Mr. Plouffe wrote in yesterday's Washington Post, quote, their message is one of no retreat on health care. He said Democrats need to quickly pass a broad health care proposal. Also on NBC Meet the Press, the senior White House advisor, Valerie Jarrett, said that we are not hitting the reset button at all. And she said the problem in Massachusetts was that the president and the Democrats had not already passed health care. And also the other aides to the president said that they are sticking to the overhaul of health care reform. That despite what we believe is an overwhelming rejection by the public of the health care reform legislation from the president. And so before you we have what is called the Declaration of Health Care in Independence. And what we point out are the problems with the health care bill as it's been proposed so far, primarily grounded in the area of cost. And we have a few different posters for you that talk about the tremendous cost. Speaker Pelosi has said that the cost would be somewhere in the area of $800 billion. That is not the truth. What we're seeing is that it's well over $2 trillion. So again, we take you to the context of the time that we're in. According to the context that we're in, we're looking at record high unemployment. I was with people from the St. Cloud Area Chamber of Commerce on Saturday who told me that today unemployment in St. Cloud stands at 11%. Just yesterday, Walmart announced that they're cutting 11,200 jobs nationwide from Sam's Club employees. When Sam's Club employees are being cut in the United States, you know that the heartland of our country is in hurt and in pain. The December housing sales came out. They've dropped 17%. It's the largest monthly drop in 40 years. And so Minnesotans are very nervous right now about the economy. Government spending levels are at a level that no one has ever seen before. In fact, it's important to note that President Obama increased government spending at the federal level 22% last year. He increased deficits 3 times higher than any previous president, and that's including President George W. Bush. Now President Obama and the Democrats want Congress to increase the debt ceiling $1.9 trillion. That's in addition to the already increase in the debt ceiling so that they can continue their binge spending. When the president took office a year ago, the national debt stood at over $10 trillion. In just 1 year's time, the president sought to increase our debt by over 40% to over $14 trillion. These aren't just numbers. These are lives that will be impacted. To think that in the history of our nation, our debt was at $10 trillion, and in 1 year we'll increase our debt 40%, that's astounding, and the American people reject that. So the president, as he passes his government takeover of health care, which his own economic advisor, Christina Romer, said, if the president's version of health care passes, it will mean an additional 5.5 million jobs lost in the United States. We can't handle any more job losses. We need job creation in the United States. So we seek a positive way forward. And that's why in our Declaration of Healthcare Independence, we are proposing a set of ground rules that we invite the Democrats to join with us to agree on. They include the following: no more backroom deals, no more negotiations behind closed doors on health care, no more political bribes and payoffs going forward, no health care bill that would mean an increase in the federal deficit, no increase in any state deficits or debts, and no increase to individuals or to employers that would be, in effect, a tax. Why do we say that? Because I want to give you one example, and I refer you to an article that was in the Washington Times newspaper 11 days ago on the marriage penalty. This hits people here in Minnesota and all across the United States. And I want to share with you that when couples making $32,000 each a year, that's essentially the salary of a first-year teacher in Minnesota with a 4-year degree, making about $32,000 a year. If you have two individuals making $32,000 a year each, or a total of $64,000, under the president's health care bill, they are at over 400% of the official poverty line, which means that they no longer would receive any federal government subsidy on health care. What that would mean is if they were unmarried, they would pay a combined total of $5,684 in health care premiums. But once they got married, under President Obama's plan, they would pay $15,000 a year in premiums. That's an astonishing penalty of 164%. Now realize, our Democrat delegation, our 2 U.S. senators, and all of our congressional delegation, except Colin Peterson, voted for these types of increases in expenditures. The American people last week in the state of Massachusetts, the voters there, rejected this type of out-of-control spending. We're saying going forward, let's at least agree on some ground rules, and we have positive alternatives. I have one bill that I proposed that I think both Democrats and Republicans could agree to. It's 32 pages long, and it very simply says this: going forward, let's cut costs on health care for most Americans, and you do it this way. Let's allow all Americans to be able to buy any health care policy in any amount, in any form, across state lines. Do it with completely tax-free money, so we expand medical savings account to any level of spending on your premiums, your co-pays, your deductibles, your prescription drugs, any health care expenditure that you have, including dental, including hearing, including eyewear. Let people buy that with their own tax-free money, and then anything above and beyond that, fully deduct on your tax return. That's 32 pages long. It would help every American, and it would immediately reduce costs. We aren't even touching tort reform or lawsuit reform. That's something that we can put on the table as a positive alternative, and they actually help Americans. I spoke with Governor Pawlenty last week. He's fully on board with moving forward with the Declaration of Healthcare Independence, and also Senator Senjum sends his regrets. He started out in his car, but he was stuck in the snowstorm. He wanted to be with us today, too, so he sends his regrets. I now hand the press conference over to my wonderful colleague, Kirk Zellers, who's doing a wonderful job leading the House Republicans in the Minnesota State House. Kurt Zellers.
Thank you, Congressman. Well, and from our standpoint here in Minnesota, we've got the example, what we would consider a great system. It could always be a little bit better because we're talking about health care. We're talking about the absolute most important thing to any family. You want to make sure that your kids are healthy, that you're healthy, that you live longer. That's the goal. What we see out of the federal legislation is we're going to make it more expensive We're going to take away your ability to choose your doctor, and then it's going to be a tax increase. So when you look across the broad spectrum, and I'll let Representative Dean go through some of the numbers, some of the things we're really talking about, the winners and losers, and where Minnesota is, where we will be if this health care plan goes into effect. And it's not that we see that health care should be dead. The government takeover part should stop. The reform part, we're all in favor of. We have been all along. We here in the Minnesota legislature have been offering solutions on our standpoint from our caucus, from some of them on a bipartisan basis, but to look at those reforms first and not the government takeover first. Because at the end of the day, not everyone's covered, even in the president's health care plan. Not everybody's covered. Premiums do go up, and there's a tax increase. And probably one of the things specifically here for Minnesota is the tax on medical devices. As someone who has Boston Scientific literally across the street from my district, it's something that they're very, very cognitive of, and that doesn't even bring in Medtronic, St. Jude's, all the folks that are around that system. Taxing them is going to mean one of two things. They're going to have less to invest in new products, or they're going to have to leave the state. And we don't want that. We want to send a message to the folks that are in our state, please stay. We're very happy that you're here, very thankful you're here, but please stay and please expand. So that's our message going forward to the federal government. We appreciate the Congresswoman giving us kind of a preview of what's coming in Wednesday out in D.C., but I'll let Matt maybe go into a couple of the particulars of how Minnesota is going to either benefit or be hurt by this proposal.
Thank you. Minnesota is a high-quality, low-cost state for health care. Just a few states maybe provide care cheaper. Maybe one or two states maybe could argue that they provide higher quality, but nobody provides better value than we do in the state of Minnesota. And unfortunately, that paired with the fact that we have a very low percentage of uninsured in the state of Minnesota means that we are set up to be the biggest losers in the federal health care reform bill. If we move to their target that the federal reform puts forward at 6%, we have to move down just 2.5% total. And the cost of doing that in the state of Minnesota, we can handle with our own reforms here. Minnesota should lead, not follow national reform. But just to move from that, we are going to lose more than any other state. And I said, well, what are the other big states that lose a lot? That the first state that when the folks that were told were analyzing this, I said, who's another big loser? If Minnesota's the biggest loser, who's another big loser? And it was Massachusetts, because they have already enacted a lot of the reforms that they're, so we're going to be subsidizing other states. So then, unfortunately, I asked, well, who's the biggest winner in this federal reform if this were to pass? And it was Louisiana. And as you can imagine, this morning that was not good news to hear that Louisiana was the biggest winner and we were the biggest loser if the federal health care reform was to be enacted. But we would be subsidizing states like Louisiana, states like Texas to the tune of $10 billion for the full implementation of this bill. Minnesota can't afford it. We're already doing a great job. We should be allowed to lead, not follow national reform. I want to thank Congresswoman Bachmann for leadership on this, and we look for the support of the rest of the delegation from the state of Minnesota moving ahead. Thank you.
Questions? Question here. You said you're characterizing the Democratic plan as government takeover of health care. President Obama has specifically said that he has not proposed a government-run health care program, and PolitiFact says that the health care plan does not call for government-run health care. Can you please tell me what it is you're talking about?
When the federal government puts a direct mandate on every individual in the United States, that is a tax, and that is the government taking over that tax, because government sets up the requirements of what must be in every health care policy going forward. That isn't the individual in a private contractual arrangement with a health insurance provider deciding what type of insurance they want to purchase. The federal government decides what the terms will be in each policy. When the government decides what the terms will be and then forces every individual American to purchase that health care, that in effect is a takeover, because then it isn't the individual's choice and it's no longer the insurance company's choice, it's government choice. And that is, for all practical purposes, government takeover. One area would be as if the government owns the insurance company, owns the doctor, but another way of having government takeover is the federal government having control over what will be contained in policies and who must purchase them. That is called regulation on steroids to the point of government takeover.
These are great graphics. Do you know who produced them, at what cost, taxpayer money?
The graphics came from one of my colleagues in Washington, D.C., and we were able to reprint them. I believe, did we get them from my colleague? Did we bring them back? Okay, we borrowed them from my colleague and brought them back.
Do you know if they were printed by a company that offers health care to its employees?
I don't know. He printed them. This was one of my colleagues.
Can you clarify, is this declaration something that your caucus in Washington has put together, and you're going to have it unveiled on Wednesday?
Yes, this is a number of my colleagues got together, and we have been working over the last week or so on a way moving forward, because the people have definitely rejected the idea of Congress passing bills that no one reads, or at the last minute where amendments, 300-page amendments, are dropped in, and no one has any possibility of reading a bill before it's being expected to be voted on. The American people reject that kind of policy making, and they reject the political bribes and payoffs, the Nebraska Cornhusker kickback, the Louisiana purchase. They reject having the president say that he would have all health care discussions in front of the public and on C-SPAN, and instead they were all negotiated behind closed doors. We reject that going forward, and so that's what we want to say in the Declaration of Healthcare Independence. We reject the politics as usual. We think that we invite Democrats to work with Republicans so that we can, going forward, have a bipartisan bill where we at least agree on ground rules going forward, that we will have all negotiations in public, that there won't be political payoffs, that we won't add to the already bloated federal deficit or burden the states. There's a tremendous cost to the state of Minnesota going forward if a government takeover is put forward, the government bill that was being proposed in the House and the Senate. Knowing that, we're inviting Democrats to come together and at least agree to the rules of the road, not necessarily the specifics of the bill, but at least the rules that we play by. Everyone should agree with that, because I think the American people have spoken loud and clear. They don't like this dirty way that the health care bill was put together behind closed doors, and they want more transparency. We agree, and we're willing to put our names down in writing to say that we will do that going forward, and we invite Democrats to join us as well, and the president going forward, so we actually can improve health care. I agree with Representative Zellers. We are not against reform. We've never been reform. That's been a talking point, unfortunately, on the side of the Democrats, to insist that we've been the party of no. We've always had health care bills. The very first bill that I introduced when I went to Congress was the Health Care Freedom of Choice Act, which would allow full deductibility for all Americans of their health care expenses, just the way that businesses enjoy now. So we've always been a party of solutions. We actually want to do something for the American people, not play games. We actually want to bring down the costs of health care for the average American.
How about pre-existing conditions, Congresswoman? Would you go that far to try to ban denial based on pre-existing conditions?
Well, I think that's an issue that we need to address going forward, but that is not a part of the Declaration of Healthcare Independence. That will be negotiated between Republicans and Democrats, how we want to deal with that solution. There's many solutions. One could be the high-risk community pools that exist now in over 30 states in the United States. There are ways that we can deal with people who, through no fault of their own, have extraordinary medical conditions, but we don't say specifically in our declaration how we're going to deal with that issue. All we're saying is let's at least agree on the rules of the road going forward. And then from there, let's sit down together and negotiate what would be good for the American people.
What do you mean by dealing with those people in a high-risk pool? You said there may be ways of dealing with people in that.
Sure, but that's not what we're here to deal with now. That is going forward when Republicans and Democrats are actually sitting down at a table together, where Democrats can bring their ideas, Republicans can bring their ideas. That's the appropriate place. What we're talking about right now is let's at least get to agreement on how we can go forward and deal with those important issues.
How about the Medicare inequities, state to state, how Minnesota?
Very important. Very important. Minnesota is also in a very difficult place, and as you know, our delegation is all signed off on a letter regarding that. And I think for both Democrat and Republican, we will come to the table as representatives and insist that Minnesota get a better shake on that issue. But again, that's the substance of the bill. And what we are saying again is just the rules, the road going forward. Let's start there so that the American people can see that we are making progress. So what we're saying is we are positive, we're moving forward, we reject politics as usual, but we want to go forward with a positive solution so we can actually accomplish a goal this year.
Earlier, you said that the vote in Massachusetts was an indication that we need to do, that people are upset about the health care issue. Exit poll out of Massachusetts showed that 52% people said that they actually wanted a stronger version of the health care bill than what is in Congress right now. Is this going to be a stronger version?
Will what be a stronger version?
What you're proposing, your
What
health care.
we're proposing is the rules of the road. This isn't the.
But do you want to get
these
to a
aren't the
stronger one, I
itemized.
guess?
Pardon?
Do you want to get to a stronger health care bill, since that seems to be what the people of Massachusetts
We
are
want to
saying?
get to a bill that's actually going to cut costs for the American people, improve quality and cut costs, and increase accessibility. The more inexpensive health care premiums are, that's the greater number of Americans that will be able to afford to purchase their own health care policies. That's why if we can have full deductibility of health care expenses and allow full tax-free purchase of health insurance, including premiums, co-pays, and full deductibility of health care expenses, that will actually bring down costs, and that's what we're hoping to do. But what we're trying to do with this declaration is to say what we are rejecting, which is politics as usual, and instead what we want to do is agree that at the minimum we're going to have full transparency on these negotiations. At minimum, no one's going to get a political payoff, and at minimum we aren't going to add to the federal or any state debts. So we're looking forward to that, and we are requesting that our counterparts across the aisle join us and put their signature to this Declaration of Healthcare Independence so we can at least start the negotiation. So thank you very much. Appreciate you coming. Thank you.
One other question. There was a ruling this past week on campaign financing in the Supreme Court, and the basic undertow of it was that corporations are people and free speech is money. Do you agree with both of those points?
I think that on this